South Africans should know within the next 48 hours whether the last of the COVID-19 restrictions will be eased. The move comes after recommendations were made by the National Coronavirus Command Council to the Health Department. Indoor mask wearing could be among the restrictions dropped. The NICD says it's seen a significant decline in the infection rate and hospital admissions, which indicates that the country has a handle on the disease. Health Minister Dr. Joe Phaahla also said the latest data shows South Africa has exited the fifth wave. The recommendations will be discussed with Cabinet before a decision is made public. Well, we're joined now by the Gauteng Coronavirus Command Council member, Professor Bruce Mellado. Professor Mellado, good evening to you. Thanks for your time. So what does it mean effectively that South Africa has exited the fifth wave?
First of all, thanks for having me, Kathy. In order to answer that question, we need to look at what happened during the fifth wave. How does the fifth wave look in comparison to other waves? And what's the perspective down the road? So essentially what we have seen during the fifth wave, which I would call also a mini wave, because it was certainly a wave with a number of cases which is not necessarily big enough to call a full-blown wave, but it's not small to disregard it, so I would call it a mini wave. Basically what we have seen is that the fifth mini wave has been a tuned-down version of the fourth wave. We see that it's very, very similar to the fourth wave in many parameters, but all the numbers basically have gone down. Starting from community transmission, number of positives, number of hospitalizations, the number of the different types of hospitalizations, in-hospital mortality, and so on and so forth. So in this sense, we can conclude that the fifth wave essentially is a transition away from the pandemic, where you have a small number of cases and then big jumps creating waves. So we're basically going from that mode all the way to what people typically refer to as the endemic phase, or in other words, a flu-like type of behavior, when we have basically some form of seasonality where the numbers of cases will grow, but they will not create waves as we know it. So that fifth wave has essentially been sort of a transition towards that phase, and as a result of that, it's fair to say that as we're walking away from it, that some of the restrictions, or most of them, should be lifted.
And you bring me to my next point, endemic and numbers down enough for us to not have to wear masks anymore?
So from the modeling standpoint, you look at it in such a way so that you assess what is the impact of reinstating or enacting a non-pharmaceutical intervention, or the impact of removing it. So if, given the fact that we are walking away solidly from this fifth wave or mini wave, it's clear that the keeping masks is not going to have a significant impact in what's going to happen in the weeks or months to come. If you look at the modeling also, what you expect, unless there are surprises, now one has to be careful when we say that we're walking away from the fifth wave or moving towards endemicity. We're not saying the whole thing is over. We can have surprises whereby new mutations can come to light that behave very differently from the original ones. That we can't exclude. But if we follow the trends that we have seen for the past months or so, it is fair to say that modeling would predict that the next wave will be even smaller than the fifth. So in that case, these restrictions are not going to be effective in either preventing or bringing down the numbers further. So it certainly seems warranted at this point in time to further release restrictions.
Would you extend it as as being beyond the mask? Because one of the things that again government has been consistent with is the issue of restrictions in venues. Do you think that those can comfortably be done away with without increasing risk?
Well, I'll let the Department of Health comment on the actual measures. I mean, our role is to advise as to the modeling. All in all, our advice and our calculations and the mathematics and all that show that if we keep going the way we are going, we may have a sixth wave, probably, that will certainly be quite small, significantly smaller than what we have seen in the past, and smaller compared to the fifth. So basically, you always have to look at these things from the cost-return point of view. So what is the impact, or how much benefit do you get from certain measures? And what you do basically is you evaluate each measure one by one, and then try to assess whether keeping it really is going to have a big impact. And if you keep it, what it is that you lose, or what is the impact of keeping those measures? You basically do an assessment on a case-by-case basis of how useful it is to keep something, given the impact they would have on certain aspects of our social life.
One of the questions, of course, that a reduction of the numbers that it brings up is that of vaccinations. When you look at the situation, Professor Mellado, do you think that we're going to get to a point where we're able to increase the appetite for people to get vaccinated?
That's a very good question, and we certainly are concerned about the relatively low intake at this point in time, and given the fact that there are sufficient jabs around, and that we have more of a problem of demand than supply. And we do know also that the numbers and the studies and signs indicate that vaccination certainly helps to reduce the probability of severe disease further. So you're basically more protected against getting really sick or going to hospital. So we certainly have been interacting with different stakeholders, including stakeholders in government, to improve how we're going to convey to the population the fact that vaccination still remains a need and a very effective pharmaceutical intervention against severe disease.
When we look to the future now in terms of how our lives are going to be impacted by this pandemic, I mean, say for what you're saying earlier, in the absence of perhaps a new mutation that has developed, does this pretty much mean that this is us now living with COVID-19?
So what we see right now is the fact that the virus continues to circulate. So all in all, even before the fifth wave or mini wave, we had a relatively active community transmission. The number of positives that we have been seeing before the fifth wave and even now is relatively high. This means that we're going to have to live with it, obviously, for quite some time to go. There's really no question about it. And it's basically us going into a mode of management of a situation rather than basically acting on it as if we were on crisis mode. I mean, this is one of the diseases that we have to cope with. It's not the only one, and we have to monitor it continuously. As I said earlier, the fact that the numbers are going down and the fifth wave or mini wave has been fairly small doesn't mean that it's all over. Basically, the virus is always there, and it may have fluctuations, may go up and may go down again, but we have to be ready for it. We need to understand how many beds we will require, how many resources will be required to face future waves, and how to deal with the issue of vaccination and other related logistics issues.
All right, Professor Bruce Mellado, let me leave it there with you for tonight. And he, of course, is a member of the Gauteng Coronavirus Command Council.